Okay, so if we have any questions, you need to step up to the mic, and then we'll also alternate between people here and people on the web chat.
Hi, my name is Bob Grayfinger. My question is for Heidi, and it's a question at the intersection of economics and psychopharmacology. We've got 2.3 million adults, mostly males, incarcerated on an average day. If I assume correctly that you don't count those as part of the 4 million unemployed, shouldn't we increase our dose of antidepressants on the assumption that public policy is going to change and we'll be incarcerating fewer of those young, mostly minority folks?
Wait, what's the question?
The question is, it's a statement. This posed as a question. If we added another 1 million or more of the incarcerated people to the 4 million underemployed folks, it would make it look a lot worse.
That's exactly right. So is this on? Do I have to speak that? So all of the numbers that you hear from the Bureau of Labor Statistics, they are civilian, non-institutionalized populations. That's the unemployment rate you hear. That's the job growth you hear. And so if you have a big shift in a different population, say the prisons population, and why not including them understates the unemployment rate is because those are folks that on average would likely have worse job outcomes if they were in the labor market. So you have just taken out a bunch of people who would have on average worse job outcomes if they were in the labor market. And so you're really distorting things by not including them. If they were in the labor market, the scene of measuring job opportunities would look worse. And then there's this whole other incredibly interesting literature that talks about the jobs impact of what we're doing by incarcerating people for individuals' futures. And it's incredibly detrimental to have a record on your job, your labor market outcomes for the rest of your life.
Hi, I'm Mary Ann Davis from the University of Massachusetts Medical School. I had a quick question for Amanda. The surprising figure that only 88% of young adults are using social network sites. Do you have any sense of what that 12% looks like who is not?
I don't. Not right now. No. I mean, I could certainly dig that information up if you were interested. Thinking about the teen population, which is where I tend to do most of my work, I know that those tend to be younger kids, and that's because of a variety of legal or quasi-legal floors in which 12-year-olds and younger are not supposed to be on social media. So for that population, I know why. I don't actually know why. I mean, we see with every technology that there's a subset of people who are kind of refuseniks, who just don't like it, don't want to use it. I don't want a cell phone. That stuff's crazy. You just call me on my home phone. Or, people whose identity is around not using the technology of the moment.
Do you have any information about the role of poverty?
So we know that in general, it doesn't make a difference. So in general, we see poorer families, there's a slight lower likelihood of computer ownership, but we don't see differences in mobile phone ownership. And in fact, we see smartphone ownership that is, it's sort of on the outside. So lower income youth and higher income youth tend to have smartphones. It's the middle income that tend to have the stick phone from mom and dad that's kind of locked down. But on either side, for wealth reasons and the upper income youth, but I think for lower income youth, it's a leapfrogging issue. It's that this is my way of connecting, and I'm going to make the investment in that. Also, there's a lot of plans around mobile phones that are aimed for people who don't have a lot of roaming issues. So let's say you're not likely to travel outside of your immediate community. If you don't need a plan that has good roaming, but can offer, so there are plans that don't offer good roaming, but offer unlimited data, text, and voice. So you can have a great phone, and as long as you don't, go to visit your aunt, you have great connectivity. And so those plans tend not to be terribly expensive. They may be $30 or $40 a month, and that's what we see a number of low-income kids having. So there certainly are. They tend to have good connectivity and are. And we do see, particularly as I said, among teens, we see very enthusiastic use of these sites. But I would say so income does not appear to be an issue.
Great. Thanks very much.
Sure.
Okay, Tara, do we have a web question? Nope. Okay, you're up.
Hi, my name is Anna Radovic, and I'm an adolescent medicine physician in Pittsburgh doing a fellowship. And I'm really excited as a new healthcare person in using social media interventions to intervene on different types of healthcare problems. Specifically, I'm interested in depression. Mm-hmm. I'm wondering whether we understand differences between adolescents and young adults who have different types of healthcare problems like depression and sexual risk-taking behaviors, how they're using social media, whether we understand that, and what you, Amanda, see as further research in those areas so we can inform interventions.
I know that there are public health researchers who are working on trying to understand those questions. I'm thinking of Michelle Ibarra at CIPHER. She's been doing a Center for Innovative Health, Public Health Research. She's been doing work that looks at some of those issues. I know some folks at the Crimes Against Children Research Center in the University of New Hampshire look often at the ways in which it's more like experiences with violence and experiences with a variety of they look at a variety of psychosocial issues and the ways in which that changes your use of various technologies, and in particular things like sexting, kind of negative uses of the technology. But I do think that we don't actually have a great understanding on kind of some of the real broad stuff that you're talking about. So that's not work that I have done particularly right now, but I do think it exists, and I'm probably not as familiar with it as I should be. So beyond what I mentioned to you, I think there is more, but I don't know specifically what they've been finding.
Hi, I'm Clare Brenda from the University of California, San Francisco, and again, wonderful, wonderful panel. I'd like to come back to the issue of economics and whether you're going to be tracking the potential impact of the Accountable Care Act at the 30-hour time, or let's say ceiling, for employees and employers who will be punished or not rewarded for providing insurance coverage for workers up to 30 hours. And I'm wondering, do you have sources of data that you'll be monitoring or that we could be monitoring to see whether there's going to be a real impact?
That is a good question, and we have people at EPI who will be doing that, and so I can get you my information or tell you who to check with, but there is the employer mandate has these weird incentives because it doesn't count for, you don't have to, whatever, the 30-hour, I'm not sure what it is, the 30-hour
ceiling, I'll call it.
So, and it only applies, that mandate only applies to businesses that are over 50, have over 50 employees.
Correct.
So there is this group of people who are sort of at risk that are in the slightly over 30 hours and work at businesses that have at least 50 workers. It's not actually a big group. So the share of the labor force, this is the only piece of information I actually have. The share of the labor force that works between 30 and 36 hours and works at businesses that have over 50 employees. So those are the ones who are vulnerable to having their hours dropped to avoid the Affordable Care Act, 1.8% of workers. So I would call that it's a non-zero number. There is this, they could see their hours dropped, but it's not a huge driving force. But it does point to this weirdness of having these exclusions in the employer mandate. But we will be looking at that and seeing if, even with this small group, can we tease out any effect? But it's small enough that it really actually will be hard to see it moving things, but we're going to try.
Well, it'll be interesting to see that data disaggregated from the overall trends that you demonstrated in terms of the lack of investment by employers in overall health insurance and how that's dropping over time.
Yeah.
So thank you so
Yeah,
much.
sure.
Hi, Larry Neinstein from University of Southern California, Keck School of Medicine. Some tech questions as we move into our interface with the millennials. Three come to mind. We had a student who got a recording contract with a TV program to record her entire freshman year. So she had that was going to be in a blog, and everything from frat parties to anything. So that was one issue. Another one was an issue of, I can't go into details, but the use of a recording device, an iPhone, in either counseling or medical visits, and recording and then blogging those, which kind of break boundaries. And the most interesting one, or I don't know if it's the most interesting one this week, where there's a site called iCupid.com where they watch individuals to send, for me, to send all of their STD results, including HIV, electronically to the website as a safe dating service. We have refused. We'll give it to the student, but we won't fax it to this entity. But we've already received several letters that were out of compliance with HIPAA. We're not even under HIPAA, we're under FERPA. But be as it may, this is going to become, I think, a larger and larger challenges by the generations moving forward.
Certainly. I mean, I think, everything from, Google Glass and the opportunity for us to all be recorded at any time by people we encounter. I mean, this is what we're trying to deal with. And I think, technology often offers us great opportunities to have to revisit our laws and the ways in which we think about things like the First Amendment and think about privacy and think about a variety of issues. And you're absolutely right. I mean, I don't have good answers for those. I mean, certainly, it's everything from, the gym banning cell phones in the locker room because they now can record people they're all together and people don't want that, to this exact, your student with the contract to record her entire freshman year. It's a new world we live in, and sometimes I think we don't have good answers or good policies. And the video, I think, particularly poses a lot of questions. And we certainly see that young adults have a lot of frustration around some of this kind of constant sense of surveillance, and that they never know when they're being photographed for the most part. I mean, the video is more of a newer development. They don't know when they're being photographed. And so, certainly we've talked to young adults who said, somebody took a picture of me at a party where I was drinking and I'm under 21. And they posted it to Facebook, and it was seen by administrators at my school who then promptly, expelled me or who suspended me for engaging in that behavior, even though I had no idea that the photograph was taken. I had no idea that it was posted. It wasn't posted by me, and I only found out about it once they contacted me and said, this picture of you has been posted, you've been identified, and you're being suspended. And that's really tough, right? That's really hard. And as we get closer to things where we have better facial recognition, which isn't there yet, as I think the Boston bombing case revealed to all of us, facial recognition is still in its infancy, but not that much of an infancy, and something that we'll also have to deal with. So a lot of challenges ahead, but I don't, I think, have anything other than to say, yes, we're already starting to deal with this, and I don't have good advice. So.
I think that's a nice time for us to wrap up, and we'll go to lunch. Thank you.
Thank you.